And that could go two different ways. Are they limited in external rotation where they can't get all the way in that position? Or do they have weakness in external rotation that doesn't provide that stability up top whenever they're in that position?
Yeah, because CrossFit teaches the external rotation, weightlifters teaches the internal rotation, and then they both have arguments for both.
So is the argument to improve one and it'll make it better? Or what's
the argument that I heard from a red shirt who said that do external rotation is because it's safer. The argument that I heard but from weightlifters is that you can really lock it up, and then you can lock it up so that you can just keep pushing it. You can keep pushing the weight up. So that's
okay. So I don't know if I understood the question. More of like strength in ER versus IR.
Yeah. Or what keeps you safer too. So
yeah, I think it depends on the movement. Certainly getting more internal rotation is going to help lock up, especially in the bottom position, and going to engage lats more because lats are internal rotator. I was picturing external rotation mobility getting into that position. So I could see both.
Yeah,
both are important.
Yeah.
I usually look at what we call arc of motion. You'll notice with baseball players and stuff, you want at least 180 of a full arc. A lot of pitchers will have a ton of external rotation, maybe 120 degrees instead of 90. But do they have at least 60 of internal? So we're looking at the full arc. They may need a ton of external rotation for that pitch. But we just want to make sure that the combination of internal and external is getting to at least 180.
Yeah.
So it kind of depends on the sport and the movements.
Right. Yeah. Yeah. In terms of the snatch, I've heard of another one is it depends on your rib cage. So I forgot. I don't know. I read all.
There's a lot on YouTube.
Yeah, I know. There's a lot on YouTube. So, but anyway, that's why I'm here talking to a professional.
Yeah, I think it's always important. And to see a professional, see someone in person, see someone who's qualified, see someone who works with that population. If you're a CrossFitter, you should be going to a physical therapist who either does CrossFit, coaches CrossFit, or sees CrossFitters on a regular basis. They know the movements, they know the demands, they know the volumes, they know the training schedules. That's different than the typical run-of-the-mill PT who might be seeing 4 people in 1 hour, right? It's just me a lot different time, quality, attention to detail. If you're a swimmer, ideally you're seeing someone who sees a lot of swimmers, or maybe they were a collegiate swimmer in the past. They can understand and relate to you a lot better. Something that I challenge my clients with a lot is they'll come to me with questions, or they'll come to me with things that they've done and things that they've tried. And sometimes the feedback is, if you could do this on your own, you wouldn't be here right now. Right? And most people want to do it on their own, and that's fine. Most people want to go to Google first, maybe some YouTube search. Maybe we're looking at Squat University or Bob and Brad or something crazy online, but then it may work a little. It may not really get you to where you need to be, because it's usually something that's a little bit more individualized. It's hard for someone over YouTube to do that, to relate to you the same way as you can in person doing a full evaluation. So I just kind of bring it up. You wouldn't be seeking professional advice if you could have done it on your own. You would have done it by now. Or people who want to lose weight, they think they have all the tools. The knowledge is there. We have tons of knowledge online, but if you could do it on your own, you would have lost weight already. So it's really important for those people who can't do it on their own to seek professional help and get that one-on-one care.
Yeah, in terms of PT too, because like I was one of those guys, right? So Google the whole thing, Chat GPT,
sure,
get the program. 3 months later, I mean, you'll feel a little bit okay, but you go back to baseline after that. I was like, I wasted 3 months. Right. I mean, I think that's the biggest piece is the efficiency. That's like hiring a strength coach. You can get stronger on your own. Hiring a strength coach, you're going to get stronger faster, no doubt. If they're programming effectively, if they're talking about nutrition, it's just a quicker route. So like, how much time do you want to spend? A lot of times it's a financial barrier. I don't want to drop the money. I don't want to spend 150, 200 bucks, whatever it is. That's fine. But we could also chat in 3 months and see where you're at. Could we have spent a couple $100 and already be there by now? Likely. Kind of like going back to that weightlifting or the having a coach do, like with Clayton. This was a long time ago. I got stuck with my weightlifting journey or CrossFit journey because I was about a year and a half into CrossFit then, and I got stuck with my snatches and clean and jerk. And I went to Clayton, a coach who already know he knew how to program, he knew how to he knew the periodization for it for 6 months straight, and took off, man.
Wow.
I mean, if I did that on my own, it probably would have taken years, because I went from 185 pounds to 245 pounds with my snatch, because he had the knowledge and I went to him. If I did that on my own doing research, that probably would have taken years.
Yeah.
So, yeah.
Yeah. And what I hear a lot clinically is, and this isn't to say all PT's the same. It is not. I've seen the good, bad, and the ugly. I've worked in 16 different orthopedic clinics over 5 states when I was doing travel therapy. It's unfortunate, but there are some really undereducated, underskilled physical therapists who are leading people in the wrong direction. So on that note, PT on ice, find a clinician that's going to look up qualified PTs who have taken ice physio courses and speaking the same language, and they're a lot more progressive in our field. So if you're looking for a PT in your area, you can just search ice, find a clinician. But what I hear from people a lot is, man, I wish I would have came in and seen you sooner. They've been struggling for 2-3 months, shoulder pain, tore their labrum, significant pain, couldn't raise their arm. Man, I wish I would have seen you long time ago, because in a month we're 80% better.
You don't have to answer this, but if you want to, you can. Can you give me an example of a bad PT or clinic? It's like, do they just throw in a default exercise in there, or?
Oh yeah, I've seen a few. Without going against my exit paperwork I had to sign when I left the company, there's an example that comes to mind out of Kingman, Arizona. Let's just say everyone who came in, didn't really matter if it was back pain or shoulder pain, but let's just say back pain, a lot of back pain in that area, chronic pain, underserved population. But anyways, let's say back pain, they come in, every single person got a moist heat pack. They lay on a heat pack for about 10-15 minutes. About that time, the tech would come over, pull it off. The physical therapy assistant would come over and give them a back massage for about 10-15 minutes. Just some soft tissue work, stroking the low back. Then they would probably lay on their back, rock their knees side to side, do a couple bridges, hip thrusters, do some clamshells. We've all done some clamshells in the past. Yeah. And that was it, bro. Every session. No progression. Nobody was getting off the table. And I'm looking around like, we don't live on a table. We got to be functional. We got to lift groceries. We got to get upstairs. We got to squat, deadlift, lunge, etc. So that's an example. And that's happening all over. Unfortunately, it's profit driven, right? It's way easier to have 10 tables over there and 10 people going at once, just doing some stretches, some massage. It's a little harder to have one-on-one care, get a squat rack, get people loaded up. Another example, I saw someone this morning. They came to me from a different physical therapist because that physical therapist said they didn't do any hands-on care. They were all exercise. It blows my mind. We should be doing it all. We should be doing manual therapy. We should be educating. We should be doing some form of exercise. It's 3 pillars to that chair.
3 pillars. Can you talk about that?
Yeah. I bring a lot of this back from the teaching and learning through ice physio. But there are 3 pillars for solid and quality physical therapy is going to be that patient education, skilled manual therapy, and some form of exercise. We got to have all 3. Now, it doesn't mean we need to do cupping or dry needling every session, but we should be affecting tissue or affecting the nervous system somehow. Easy way to do that, adjustment or manipulation, whatever you want to call it. It's the same thing. So we're cracking backs, we're dry needling, we're cupping, we're loading tissue, we're educating them on what this is, how long it's going to take, what they can do at home, what lifestyle habits they should be considering changing. So yeah, all 3 pillars.
Yeah, for your first example, I'm thinking the moist heat pack and stuff like that and the massage.
Yeah.
I'm thinking it's because it gives people that immediate relief, right?
For sure.
And then when they get that immediate relief, they go out. It's like, oh, this place is awesome. Put 5 stars on there and everyone goes.
100%.
And then, but they don't get stronger. The underlying condition doesn't go away. So they keep going back.
Yep.
So I'm guessing that's what was happening.
Yeah. And different schools of thought. It's a pretty good business model, right? You can see someone forever. There's many tools in our bags. There's many things I can do to make you feel better. And now having my own cash practice, some people come to me just to feel better, and that's fine. We'll do soft tissue for an hour if we have to. We'll do dry needling and adjustments or whatever it is. But I tell people, I make sure I educate them. We can do this each week you come in and you can feel better, or we can do this for a period of time until you're feeling better. We open a window of opportunity to load your tissues. Then we move into more loading the tissue for adaptation, for strength, getting you moving more. That's the long-term ticket. So I tell them, we can do this feel-good stuff, but you need the strength, the mobility, stability, etc. on board to actually fix the issue and be sustainable long-term. Mm-hmm. If you don't want to do that, I'll see you, but I'm going to keep putting it in your ear. You know what I mean? Mm-hmm. We're going to talk about your diet. We're going to talk about your sleep. We're going to talk about your alcohol intake because all that's relevant.
Mm-hmm. Yeah, because this was a long time ago. I saw a video of some guys. They were saying if you go to a chiropractor and they tell you just to keep coming out without telling you to exercise, actually fix what's going on, fire that chiropractor or something like that.
I would agree.
Yeah.
I would agree. In my opinion, it's malpractice.
Interesting. You would even put it in that category, huh?
I would go that far to say it's borderline malpractice. To do something, assuming they know better, right? There's a lot of good chiropractors out there. There's some poor chiropractors, just like PT, just like coach, anything else. But the good ones are educating their patients on what this is, how long it should take. You can come back for an adjustment, manipulation, whatever to feel good, but you've got to be doing XYZ outside the clinic.
Mm-hmm. Yeah. Yeah. The one that I went to, it was actually a really good one. Unfortunately, I don't remember the place as well, but like I went for a chiro and there was an FMT, functional movement therapist. And she's like, you need to go to this person as well.
Yeah.
And I was like, I think you're just money grabbing. Like, no, you really need to like do some functional movement therapy as well, not just getting cracked here.
Yeah.
So they did that, and then that's why I kept going back, and that helped a lot as well. So,
yeah. The problem I have is if we're just getting cracked and not doing anything else, what are we doing? Are we just looking for the endorphin release because we know we get that? Are we just looking for the nervous system to get a nice reset out that muscle? We know we get that. But if cracking it's going to fix your problems, why are you coming back for 3 years every week? I have that conversation with people all the time.
Right.
How long you been going? A couple of years. I usually go every week. Well, is it fixing your problem? It doesn't sound like it, right? Yeah. And we're just addressing one piece of the puzzle. Soft tissue, nervous system, tendons, ligaments. There's a lot going on. It's not just cracking backs.
So would you say would it be the same with dry needling, cupping, massage?
Yeah.
100%.
I see people who just want dry needling. I tell them, I'll do that, but are you doing XYZ? Can you implement this one little thing throughout your day that's going to help this last longer? If not, I'll needle you as much as you want. Right? But I'm going to educate you.
Yeah. Nice. All right. How about this last topic that I want to talk about is about, it's all about warming up,
All right.
This is
speaking of warming up, I'm cold.
You're cold. almost done. Hang in there. So, from a PT's perspective, right?
Okay.
Can you let us know whether these practices are either useless or effective? I know we're trying to apply this to gym pop, CrossFitters, weightlifters, bodybuilders, etc. So you can probably explain some of the nuances in whatever sports, whatever come to mind. Ready?
Okay.
Yeah. So we'll start with the first one, foam rolling.
Oh yeah. Foam rolling. I have a foam roller. I do. It's overused by a long shot. I don't think it's important from a preparation standpoint to be, I see a lot, but to come in before a workout and roll out your whole body. I don't think it's an effective use of time. If you think it feels good and you think it helps you, I'm always going to say go for it. But if you want to be effective and efficient with your use of time, I use foam rolling mostly for thoracic spine. So I'm getting on it this way, I'm arching over it, might get a few pops, but I'm mobilizing my thoracic spine for any days that I'm overhead or doing front squats because we need more spinal extension. So I use it to pop my back. I use it for more mobility. So I'll do quadruped, thread the needle with the foam roller. It gives me something to press onto. But if you're just coming in, massaging, rolling on your calves and stuff, it's not gonna, I think it's useless, essentially.
Stretching, when we talk about that.
Yeah, active versus static. Active versus static. Active prior to your movement or your exercise, whatever you're doing. Static after. And you guys do a good job at that. The only thing that I see is people don't always do it.
Right, yeah.
I don't know if we hit on that, but something I've seen commonly from CrossFitters is if I could give them any tips as a whole, listen to the coach, stay for the cool down, stay for that session at the end. It's super important. Like, take the warm up and cool down seriously.
Cool down's like serious stuff, right? Because it helps you for the following workout.
Yeah.
Even with swimming, when I was with swimming, I mean, after the race, they'll go back to the warm-up pool and they'll be swimming there for 10, 15, 20 minutes.
Yeah. Because the competition's done, right?
Yeah.
You're still swimming.
Because it preps them for the next one. Like,
yeah.
It's really good. General warm-up.
General warm-up, like just getting the heart rate going?
Yeah.
Great.
Well, just to be specific, I'm going to ask movement-specific warm-up as well, because we do this too, but general warm-up.
I think it's great. I think generally speaking, we should elevate our heart rate to get more blood perfusion to our tissues. Less blood flow, vital organs, more out to our extremities before we're about to load them. So I think general warm-up is good. Getting on the bike, getting the heart rate going is helpful.
If you're a powerlifter, or let's say bodybuilder, this is because a lot of people do bodybuilding, right? If you're going to be benching, do you need to ride that bike?
If you're benching, is it advisable to get your heart rate elevated? I would argue yes. If you're crunched for time, do something. Push-ups, some kind of prep, horizontal push. Push-up, barbell, bench, whatever it is.
Ski erg, rower.
Sure.
Yeah. All right. How about movement-specific warm-up?
I think it's great. It's a way to prime our nervous system, tell our body what we're about to do under more load. So, for example, squat day, we're going to start out with those body weight squats, maybe banded to get some hip external rotation activation. We're going to go barbell and then start loading from there. So I think it's great.
Activation drills like clamshells, glute bridges, banded walks.
Yeah. The PT stuff. Yeah. Sometimes people call it. Yeah. So I think out of that whole list, there should be priorities. If time's never a factor, dude, hit all 5 of those things. Why not? Foam roll, stretch it, mobilize it, get the heart rate up, movement specific, activation, all that. But I think most people are looking for, what do I need to do to have a good workout, and then don't do any extra. Like I got an hour, let's just get after it. So I think activation comes down to ideally having some kind of assessment. Where are we limited? What are we weak at? What are we tight at? Then you address those. So for someone who can't get a full depth squat because they can't activate external rotation or open their knees wide enough to get down, they should be doing some kind of activation drill. For someone who has, the example of my lifter overhead, has trouble firing his lower trapezius on the right, we're doing some lower trap activation prior to his barbell snatch before he loads it. So for those people with some kind of impairment or deficit, I think it's super helpful. I think for the general population, just get warm, go through movement specific, then load.
Hey, Dr. Wade, thanks for coming.
Hey, absolutely. Thanks for having me.